Welcome back to the deep dive. Today, we are taking that high-powered lens of ours to a condition that I know causes so much frustration for millions of people. We're talking about rosacea prone skin.
A really important topic.
Absolutely. You sent us everything, the clinical research, the treatment guides, and all of the details on daily routines. And our mission is to distill it all. We're going to walk through what rosacea even is, the surprisingly broad range of triggers, and what actually works.
And that's so crucial because rosacea is much more than, just a red face. It's a chronic inflammatory occurrence. That's the key phrase.
A chronic inflammatory occurrence.
Exactly. And it demands consistency. If you treat it like a simple rash, you're just going to be fighting flare-ups forever.
So we're aiming to give you a shortcut to really understanding it.
A shortcut that brings together the medical side with, just smart self-care.
Okay, so let's unpack that core definition. At its simplest, rosacea is what exactly?
It's a chronic condition, it's not contagious, and it mainly hits the skin on the face.
Right, so you get that persistent redness, the flushing, and sometimes those little acne-like bumps.
Yep. And it usually centers right on the nose, cheeks, forehead, and chin.
But the cause is tricky.
That's where it gets complicated. The exact single cause is, it's still unknown. We don't have one button to stop it.
So what do we know?
We know it's a mix of factors. You've got your genes, you have environmental stuff, and then an overactive immune response.
So if the cause is murky, who's most likely to get it? Is there a profile?
Oh, there's a very specific profile. It leans heavily towards middle-aged or older adults.
And it's more common in women, but the source has made a really interesting point here.
Yes. While women have a higher prevalence overall, men who develop it often get more severe symptoms, much more severe.
Right, and the traditional risk profile points to fair skin, light hair, light eyes.
Absolutely. People with, say, Northern European or Celtic ancestry, it's a very, very strong genetic flag.
But here's something critical we found, and I really want you to hear this. Rosacea is often underdiagnosed in people with darker skin tones.
Massively underdiagnosed.
Because that classic persistent redness, the main sign everyone looks for, is just less obvious.
Right. So the person might come in complaining about sensitivity or swelling or bumps, but the doctor doesn't see that permanent blush, and the diagnosis gets missed, sometimes for years.
That's such a powerful point.
It is. And beyond genetics, the environment plays a huge role. Family history is one thing, but chronic sun exposure, that's probably the biggest accelerator.
And I saw that extreme climates, both hot and cold, and high levels of emotional stress are also big factors.
All major contributors, yeah.
Yeah.
So let's get into the specifics of identification. Knowing what to look for is half the battle.
Okay, so the visual signs.
Visually, you're looking for that persistent facial redness, what doctors call erythema. It can look like a sunburn that just won't go away.
And then the little visible blood vessels.
Cholangioplasia, yes.
Oh, yeah.
Those little spidery lines, especially on the cheeks and nose.
And the bumps. This is a key diagnostic clue you pointed out.
It is. You get these red bumps and pimples, some with pus. But here's the thing. They do not include blackheads.
That's the dividing line between this and, say, common acne.
That is the clean dividing line. It's a huge clue for doctors.
And then there's the feeling of it, the flushing.
The flushing is central. It's this sudden, intense wave of heat and redness. It can start on the face and just spread down to your neck and chest.
It's not just what you see, though. So much of the distress comes from what you feel.
Absolutely. That heightened skin sensitivity means you get burning, stinging, intense itching.
Especially when you put products on your skin, even ones that used to be fine.
Exactly. And you might get these patches of rough, dry skin, which is a sign of a damaged skin barrier.
We also have to talk about ocular rosacea. I think a lot of people don't even know this is a thing.
It's so common. Up to half of all patients can have it. Your eyes get burning, irritated, red, super dry. Sometimes the eyelids get swollen.
And what's wild is that the eye symptoms can show up before the skin symptoms even start.
They can, or they can happen at the same time. But if you don't treat it, it's not just uncomfortable. It can actually lead to vision problems.
Okay, so that needs immediate attention.
Immediate.
So given all this, let's talk triggers. Is there a number one enemy here?
Sun exposure. Hands down, UV rays are at the top of the pyramid, a huge source of inflammation.
Okay, sun is number one. What's number two?
Temperature extremes, and that means both ways. Excessive heat from hot weather, a hot shower, even indoor heating.
But also cold and wind, right?
Yes, anything that forces those reactive blood vessels to rapidly change size. Even a hot cup of coffee can do it for some people.
And the lifestyle list is long. Stress, anxiety.
Huge triggers. Then you have spicy foods and alcohol.
Red wine is the one that always gets called out.
It's a very common and aggressive trigger for many people. And even intense exercise,
Yeah.
anything that really raises your body temperature.
And finally, products. You have to become a label detective.
You really do. You have to avoid skincare with alcohol, witch hazel, fragrance, menthol, basically anything harsh.
And even some medications can be a problem, like certain blood pressure drugs.
Yeah, anything that dilates blood vessels can potentially make things worse.
So if you suspect you have this, the sources are clear. There's no single blood test or swab for it.
No, diagnosis is all about a careful clinical checkup. A dermatologist does a physical exam, looks at the pattern of redness and bumps, and goes through your whole history.
And they have to rule out other things, don't they?
Absolutely critical. They have to exclude lookalikes, things like lupus or seborrheic dermatitis, or even an allergic reaction. They're looking for that specific pattern.
And getting that diagnosis early is so important. This isn't just about managing redness.
It's about preventing progression.
Yeah.
If you leave it untreated, it can lead to permanent changes. That redness can become constant, the blood vessels permanent, the skin texture can get coarse and thick.
Which leads to that severe complication we mentioned, rhinophyma.
Exactly. It primarily affects men, and it's a gradual thickening and swelling of the skin on the nose. It becomes bulbous and red.
Which has to be just devastating emotionally.
Incredibly distressing. And that speaks to the wider psychological impact. The sources are very clear about the link to self-consciousness, anxiety, even depression.
Because it's on your face. You can't hide it, and it fluctuates.
You feel a total lack of control. But maybe the most important insight from this whole deep dive is the connection to your overall health.
Right. This was a big one.
Studies are now suggesting that rosacea isn't just a skin issue. It's associated with a higher risk of developing things like diabetes, heart disease, even Alzheimer's.
Wow. So the inflammation on your face could actually be a sign of something deeper happening inside.
That's the implication. It elevates this from a cosmetic concern to a real health and wellness issue. Proactive management is not just for comfort anymore.
And just to round that out, other conditions can pop up alongside it, like seborrheic dermatitis or eczema. So a professional really needs to sort through it all.
That's why you need an expert eye.
Okay, understanding all that makes the need for treatment feel much more urgent. Let's talk about the professional approach. We can break it down into a few areas, starting with topicals.
Right, the creams and gels. The big four are ivermectin, which is great for the bumps.
Then azelaic acid for both bumps and redness.
Yes. Metronidazole for the inflammation, and then you have bromonidine or oxymetazoline.
What do they do?
Those are pretty cool. They're gels that temporarily constrict the blood vessels, so they reduce that persistent redness for, up to 12 hours. It's a temporary fix, but it can be a lifesaver for a big event.
Then for more severe cases, you move to oral medications.
Yep. The most common is a low-dose doxycycline. It's an antibiotic. But at this low dose, it's used purely for its anti-inflammatory power.
And in the most severe cases.
Rarely, they might use isotretinoin.
Yeah.
And for that intense flushing, they can use things like alpha or beta blockers to help control that vascular reaction.
And then there are the aesthetic treatments for the permanent changes, like those visible blood vessels.
This is where lasers and light therapies come in. Things like pulsed dye laser or IPL.
And how do they work?
They send a very specific wavelength of light into the skin that gets absorbed by the red blood cells in those tiny vessels. It heats them up, they collapse, and the body just reabsorbs them.
So it gets rid of the vessel without damaging the skin around it.
Exactly. It's incredibly precise. And for advanced rhinophyma, they can use surgical techniques or CO2 lasers to actually reshape and smooth the nose.
But none of that works without the daily self-care. So let's build that gentle routine for everyone listening.
This is the foundation. It all starts with cleansing. You need a non-drying, fragrance-free cleanser. And always, always use lukewarm water.
No hot water, no harsh scrubs.
Nothing that causes friction. You have to be so gentle.
What about exfoliating? That seems scary for sensitive skin.
It can be. The sources recommend a leave-on BHA, which is salicylic acid. But you start slow. Maybe every other day?
Why BHA and not an AHA, like glycolic acid?
Great question. So AHAs are water-soluble. They work on the surface and can be irritating. But BHAs are oil-soluble. And more importantly, they are naturally anti-inflammatory.
Oh, interesting.
So they can calm redness while they gently exfoliate. It's a much kinder option for rosacea skin.
Then now for the absolute non-negotiable step, sunscreen.
Every single day. This is your shield. It has to be a mineral-based sunscreen, SPF 30 or higher.
So only zinc oxide and titanium dioxide.
Only those. They are physical blockers. They sit on the skin and reflect the UV rays away. Chemical sunscreens absorb UV and turn it into heat, which is the last thing you want.
And for moisturizer, it's about repairing that barrier.
Yes. Pick one for your skin type, a lotion for oily skin or a richer cream for dry skin, and look for powerhouse ingredients.
Let's name a few. Azelaic acid is one.
Amazing for calming redness and inflammation.
Yeah.
Then there's niacinamide or vitamin B3.
Great for strengthening the skin barrier. I also saw tranexamic acid mentioned for redness.
Yes, it's becoming very popular for that. And calming botanicals like Centella asiatica are wonderful.
And one last surprising note from the research. Retinol, if introduced very carefully, can actually be one of the best long-term ingredients.
It can, but that's one you definitely do under professional guidance.
Okay, moving from the bathroom to the kitchen, the diet connection is a huge piece of this.
It really is. The advice is to limit foods that are high in histamine because it seems a lot of rosacea patients have trouble processing it.
So that means things like aged cheeses, cured meats, even tomatoes and citrus for some people.
Exactly. And of course, the big vascular triggers: spicy food, super hot drinks, and alcohol.
Red wine, there it is again.
It's the most common culprit. On the flip side, you want to load up on anti-inflammatory foods.
So fish like salmon, nuts and seeds, olive oil.
Yes, and certain vegetables like onions and garlic. And the sources also pointed to fermented foods, sauerkraut, kimchi, kombucha for gut health, which can translate to calmer skin.
We've mentioned stress a few times as a top trigger. Let's talk about how to manage it.
Well, stress releases cortisol and adrenaline, which are inflammatory hormones. So anything you can do to lower that is key. Mindfulness, meditation, deep breathing, gentle yoga.
And the research got really specific here. It wasn't just about general relaxation.
No, it's specifically highlighted cognitive behavioral therapy, or CBT.
As a proven technique for managing the stress and actually improving the physical skin outcomes.
It's an active intervention that really works.
And for exercise, you just need to be smart about it.
Adapt. Avoid working out in extreme heat or cold. Choose something that keeps your body temp stable, like swimming or using an elliptical in an air-conditioned gym.
Finally, just a few quick makeup tips.
Always start with your moisturizer and mineral sunscreen.
And a green tinted primer can be a game changer. That green color cancels out the red.
It really does. Then stick to lightweight mineral-based foundations and powders. Apply it gently, just dabbing, not rubbing.
And always take it all off at night with a mild cleanser.
And we have to say it again. Please see a dermatologist if things aren't getting better, if you see those bumps or vessels, or especially if you get any eye symptoms.
Or if it's just taking too big of an emotional toll.
Yes, it's a chronic condition. You need a long-term partner to help you manage it.
That was an incredible deep dive, going so much further than just surface redness.
Yeah.
I think the biggest takeaways for me are it's a chronic inflammatory occurrence, that lack of blackheads is the key identifier, and mineral sunscreen is your absolute best friend.
Absolutely.
Yeah.
So what does this all mean for you moving forward? We talked about that research associating rosacea with an increased risk of serious things like diabetes and heart disease. And that raises a really important question. Given that we know stress and inflammation worsen both your skin and those internal risks, how might diligently managing your daily skin health and your triggers also be proactively contributing to your broader long-term physical well-being?
That's a powerful thought, that your face might be giving you a critical window into your overall health.
It just might be.
Something to think about as you start becoming that label detective. Until next time, stay well informed, and thanks for diving deep with us.